checking my order. I'm gonna be gathering supplies. Knock, knock, knock. Hey, Mr. Rodriguez, my name is Cameron. I'm gonna be your nurse today. I'm gonna provide privacy real quick. I'm gonna do a little hand hygiene, don PPE. And then, Mr. Rodriguez, is it okay if I check your armband real quick? And while I do that, can you tell me your first and last name and also your date of birth? I've confirmed patient's ID ×2. Make sure that I'm doing any safety checks, make sure that his bed is locked and in place, and that I'm lowering his bed rails and raising the bed to appropriate height. Mr. Rodriguez, do you have any allergies, or are you currently taking any medications right now? He says no, that he's not taking anything right now. And so the next thing I want to do is explain what we'll be doing today. So Mr. Rodriguez, we're going to be doing the head, eyes, ear, nose, and throat assessment for you today. And I heard that you've also been having some trouble breathing, so we're going to do a respiratory assessment after that and see if there's anything we do to help you out with your breathing. Is that okay with you? He says okay, and that sounds good. So the next thing that I want to do is make sure that I'm getting a baseline of vitals for my patient. And after that, we can make sure that we're going into the procedure that we're doing for today. So with the head, eyes, ear, nose, and throat assessment, I make sure that I'm going systematically through inspection first, and then I want to move my way to palpate and osculate. But first with the inspection, I'm going to start with the head and the face, and I'll make sure that I'm checking for skull and facial symmetry. See if there's, as I go through and I look, I want to see if there's any bumps, masses, protrusions, any swelling. Also checking for or inspecting just the appearance overall too with the skin. I want to see if I can detect any rash, any freckles, facial hair, or any visible trauma for that matter too. Next, I want to make sure through inspection that I'm going to the eyes and the orbital area, checking the sclera of the eyes on the white, the conjunctiva, and see if I can notice any discharge coming from the eyes on the inside or outside. Next, moving to the nasal cannula, I want to make sure that I'm inspecting the color, make sure that he has patency in each nostril. I'm going to check for any discharge and observe for any polyps inside his nose. So I can go ahead and take my little pin light and make sure I check inside each nostril. When I'm checking inside, I'm looking for the polyps. I'm looking for any deviated or perforated septum to any obstruction in the nasal cavity. Next, I make sure I can go around to his ears, and with inspection, I want to check the auditory canal and also the tympanic membrane. I'm looking for color and appearance, and see also if there's any obstruction, if there's accumulation, more so than needed, of earwax, if there need to be any cleaning. Also, we're going to go through the mouth and the throat. I want to check his oral mucosa, make sure it's moist and pink. So I ask Mr. Rodriguez, you can open your mouth and say, ah. So I do that, I'm going to check. I have my tongue depressor to push down. I also want to inspect his throat color, see what the texture is to make sure that, see if there's any exudate or anything, any postnasal dripping down the back of his throat. Also want to assess his tonsils for swelling or redness. Next thing, I'll move my way down to his neck. Make sure I'm checking for any swelling, any mass distension. Same thing, make sure that there's also symmetry with the neck. Make sure that one side isn't more protruded or any jugular vein distension. Now that we've gone through the inspection and we see that everything looks for most part, I also make my way back to the eyes and make sure that I can inspect the eyes. So one thing that we want to check is to make sure that his pupils are equal, that they're round, reactive to light and accommodation. So I can go ahead and take my pin light and I can check for pupillary reaction. Two things when I shine that light in his eyes. What I'm watching for with the pupil is to see if, first upon inspection, if the pupils are unequal, irregular, or non-reactive to light. And then once I do shine the light, I want to check also for meiosis or mydriasis. Meiosis is going to be an excessive constriction of the pupil where it doesn't expand. And also mydriasis is going to be where the pupil is dilated more than normal. And if we have dilated pupil and our patient has any type of fall or trauma, a dilated pupil can sometimes lead you to suspect a brain injury. So I'm going to take my little pin light. I'll make sure I check each pupil. One at a time, I'm looking for the pupil reaction. Once it is introduced to light, looking for that pupil constriction. Also, after I've done my pen light, I will make sure I'm checking eye movements. I will check for nystagmus. I want to check for clear peripheral vision. So one thing that I would have him do with the test with this is that I would take my pen light. I'm going to ask him to go ahead and follow my pen light while keeping his head straight. So Mr. Rodriguez, I want you to go ahead and follow the light without moving your head. I move it. All right, he has good eye movements. I'll make sure that also with my ophthalmoscope that I want to check for disc margin, and also I want to examine his retina and make sure that I can see inside his eye and make sure that everything is looking right in there as well. Now that I've done my inspections, I can move to palpating, and I want to make sure that I go through and with the top of the head, the scalp, that I want to make sure that I palpate and I feel for any masses. Also, while I'm palpating, I can observe for any balding or tenderness and any masses that I feel while palpating all throughout his skull. And the next thing I want to do is make sure that I'm going down and palpating through his sinuses. I want to check his frontal and maxillary sinuses. And for any tenderness. And I'll make sure that I explain to the patient, Mr. Rodriguez, if at any point through any palpation you feel anything that's tender, please let me know. And also now and throughout every and single, I want to make sure I'm doing therapeutic communication, sit facing the patient, open position, leaning towards the patient, eye contact and a relaxed posture, make sure I'm using sympathetic and empathetic communication with the patient well, making sure that I am silent when necessary and using touch when necessary, obviously making the patient feel comfortable and building that trust factor with my patient. So now I've done the sinuses and assess for any tenderness. I want to make sure I go to the jaw. I'm going to lightly palpate on each side. And I'll ask him to open and close his jaw, and I'm going to check his range of motion, making sure that he fully open and close. And also once I'm feeling on the sides while he's opening and closing with the range of motion, I'm going to check for any clicking, any tenderness, anything, maybe sign symptoms related to lockjaw. After I palpate the jaw, move its way down to the neck to the carotid arteries. Make sure I palpate one at a time and that I'm not palpating on both and obstructing blood flow or causing the patient to pass out. Also, when I am with the carotid arteries, I can take my stethoscope and I can auscultate, make sure that I'm listening for any thrill or bruit, make sure there's equal amount of pressure and that he has equal pressure and vibration. Next, I make my way down to his lymph nodes. I want to palpate on the on his lymph nodes on the head, going down to the neck, through the subclavicular line and going to auxiliary lymph nodes. I'll make sure that I'm feeling for any swollenness, any tenderness, any sensitivity or any accumulation I can feel. And also with his, I want to assess his thyroid on his neck. I'll make sure that with the thyroid that I'm checking for the nodules, I'm checking for any enlargement, swelling, or tenderness there as well. So now we've gone through the head, eyes, ears, and nose assessment. Mr. Rodriguez, everything looks to check out well, and no abnormal findings for this part. So I'm going to go and check with your provider real quick, and I'm going to see if there's anything particular that they might want me to get for your respiratory assessment.